Good morning, this is Thalia MK at 2024 Health 2.0 Conference Dubai, and we are with Mr. Jussi Määttä. He has been awarded as an Excellence Award, and he is the CEO of Buddy Healthcare. First of all, congratulations.
Thank you.
Welcome to be here. Buddy Healthcare, it's like my friend taking care of me. Is it like that? Tell us more about it.
Yes, you are right. It's almost like that. At Buddy Healthcare, we automate patient care pathways from home to hospital and from hospital to back home. And what does mean? For example, when patient is scheduled a surgery at hospital, they get our app, and in the app they get all the information, actions, questionnaires, follow-ups, reminders they need to take to navigate it throughout the process. We take care that the patients are at the right time, at the right place, at the right condition.
Okay.
So literally, we are like a buddy.
Yeah,
for
like
the,
a
for
buddy
the,
taking care of
buddy,
you.
buddy are taking care of the patients, and at the same time, when we provide help and assistance for the patients, we are buddies for nurses mainly who are taking care of those patients. So for nurses, we show easily like in which patients are ready, which patients have any exceptions that needs to be intervened. So it's like a green light, patient has done all the tasks with no exception, he will be ready for the surgery. Or there might be another patient who has reported that she's using a blood thinner and she may need further instructions to be ready for the operation. So we are buddies for everyone.
That's awesome. But when you say like healthcare, are you guys associated with the proper health channels like hospitals and clinics to take care of a patient, or is it like a private app?
We sell this to hospitals, and we help hospitals to become more efficient, reducing administrative burden. We help hospitals to reduce cancellations, improve patient experience, collect patient-reported outcomes, and in value-based care, we are everything what is needed for value-based care, treating more patients with less resources and improving patient experience and being even able to report that back to the payers.
So when you say after the hospital and all the procedure is done, you are there as well when they're at home. What do you mean by that? Like when they travel, when they get back to home, and then there is like a procedure to follow?
Yes, there might be a recovery protocol to follow, some instructions they may need to remember and take, or remember to take medicines. We provide like a timely checkups with the patients, and this process is always customized for not for a specific patient, but for a hospital or a medical specialty or indication, so that the patients get the necessary follow-up that they need to take, so that hospitals can identify the patients who may have a risk for a readmission, for example.
Okay, so for if I'm a patient or a customer, I have to update all of those details to be alarmed or to be taken care of, or is it the hospital or the doctors?
For them is they save resources because they know that you have got the instructions. They can follow what you have done. To be honest, they don't necessarily care whether you have done all the recoveries or trainings you need to take, but what they care is that are you recovering really? Are you getting well? Do you have a risk for a readmission? Because hospitals need to pay extra if they need to take care of you. So the value for them is that they can identify the patients who may have a risk and then intervene instead of just hoping that everyone will be good.
Yeah. So when you say app, so I'm assuming it is globally available, or is it like?
It is globally available, but in fact, as we sell to hospitals, you won't see their Buddy Healthcare app around. We white label application for the hospital, so it's always branded for hospitals, published by hospital.
Okay. So as you're here in the Middle East, the laws are different. When you talk about healthcare, a law. These are the two specific, very high-end aspects where the laws are very strict or very different.
Yeah.
When you come from different country or different region, how do you deal with what are the challenges your company deal with?
That's definitely a challenge. There's no question about it. Probably the good thing is that EU laws are quite strict and regulations down there. I know that they are strict in Gulf region as well. Like they have to stay within the borders. There might be medical device regulations. There are security laws that needs to be followed. And I think that that's a challenge in general in healthcare, that like companies cannot really just scale and take a plan that now we sell in this country and next month we open office in the next country and then in the following country. But you really need to plan when to enter, to do market clearance, go through all the laws, probably hire a consultant that verifies, yes, you have understood correctly. And then you finally, when you think that you have a green light, you can start selling.
Okay.
So it really slows down the innovation. It slows down scalability of the business. It actually slows down the whole healthcare digital development.
So, for example, I'm a doctor, or I'm trying to open a clinic, and if they're new, like they're new clients, how they can approach to you, and what are the pointers they have to keep in mind to provide those information to you or your company?
You mean from regulation point of view, or
yeah, all of, for example, Middle Eastern. If I'm a doctor and I want to apply for your services.
Basically, how we approach that is that, like, if we don't, for example, have yet customers in Dubai and there would be a clinic in Dubai who would like to take our software into use, we would be happy to talk, but we should basically tell you that, listen, we would love to work with you, but we'll take month or two to actually go through the regulations to make clear that we can safely offer the service for you.
Okay, fine. Thank you so much. But tell us, how do you feel receiving an award for an app which is actually helping and being a friend to all the people who are not having anybody in their life?
First of all, I want to highlight that it's not only an app, it's the most visible part of the software, but actually reasons why hospitals buy our platform is that we are helping them to reduce administrative burden and treat more patients and treat them more efficiently and even save time to document the care. So they are buying the platform. But the recognition, that definitely feels good. I appreciate the recognition. This doesn't happen too often. Like, the company is now 9 years old, and of course in the early days of the company, when we were really in the startup mode, there were lots of competitions, we got recognitions, we got awards, but now during last couple of years when we have tried to scale and we've been able to do that successfully, you don't really see the awards, you just see the challenges, you see some wins in the business. So this definitely feels good, as this is recognition for the long journey we have taken.
How does it feel to be at Health 2.0 conference?
It has been a great experience. Although we are here in Gulf region, I was actually expecting to see local people, but this is really a global conference, people all the way from the US to Japan and everything between. So it has been a great experience.
Thank you so much. Congratulations on your award.
Thank you.
He said, it's not only an award, it's a really good resource to have to save up time and to save up paper. And it's just one more person to help you feel better and achieve better health. And on that note, be healthy, be kind, avoid using plastic, wastage of water, avoid that. And this is Thalia MK signing off. Thank you.